Hello, good day. My name is Dr. Chudi Ufondu of ATG as a gynecologist, and today we will talk about ovulation and fertility window. So, every woman has a cycle. So, your cycle is the total length of what happens in your body in regards to your reproductive system. So, your cycle is the interval between one period of bleeding and another next period of bleeding. The normal regular cycle, which most women will have, is 28 days cycle. But 28-day cycle is not common for every woman. The normal range of cycle is 21 to 35 days. So if your cycle is 21, it's considered normal. If your cycle is 35, it's considered normal. Both of them are normal, but they are on the lower limit of normal and upper limit of normal. In gynecology and women's health, it's important we know the normal. When we know the normal, we can begin to know when things become abnormal. When it comes to the bleeding days of a woman, we also have a normal. So if you're bleeding from 2 days to 7 days, it's considered abnormal. Sorry, it's considered normal. If you're bleeding more than 7 days, it's considered abnormal. If you're bleeding just for one day, it's also considered abnormal. So it's important we understand the normal so we can begin to make meaning of the abnormal. Now, the reason why I started with the cycle is to begin to make sense of what ovulation is all about. So every woman has a specific ovulation based on the cycle. So if we use the 28 days I already mentioned, if we go in the middle, you will have 14. So half of 28 is 14 days. So it's expected that on day 14, one of your ovaries will be primed to release what we call a dominant follicle. That dominant follicle will contain an egg. The process of releasing the egg is simply what ovulation is all about. In most women, they might have certain things that happen that will tell you, yes, you are about ovulating. So they are called non-specific signs of ovulation. The cardinal ones are increase in your cervical mucus. So within that day 14, if we're using the 28-day cycle, which is the common one we use out there, so you will have increase in your cervical mucus. So you will notice a kind of an egg white appearance in your cervix. Remember that the cervix is the junction between the vagina and the womb. So very important structure in the female reproductive system. Some women will notice increase in libido. Some women will notice bloating. Some women will have what we call mid-cycle pain, and some women will spot. There are no one sign for all. Some women will not experience this, but they are ovulating. Ovulation is a 24-hour event. So it's expected that when you ovulate, within 24 hours, if there's a contact between the released sperm in the ampulla, that woman will become pregnant. Now that's ovulation. Without ovulation, there won't be pregnancy. So you have to release your egg so that the egg will be met by the sperm for you to have a chance to do what? To become pregnant. So ovulation is the cardinal event that must happen in a woman before she can become pregnant. Very important to understand this concept. The simplest thing you have to be conversant with in ATG is ovulation. We've taken time to teach ovulation since inception, so it's important you understand it properly. When you understand it properly, your journey to becoming a mother will begin. And it's not just for motherhood. Every woman of adult age, of reproductive age, should know about their ovulation because when you know, you can begin to make sense when things go abnormal. Now, let's talk about the fertility window. The fertility window is that period in your cycle you have the best chance, the best potentials, the best probability, the best likelihood of becoming pregnant. Your fertility window is actually calculated using the half-life of the egg and the sperm. So the half-life of the egg is entirely different from the half-life of the egg of the sperm. The sperm, when deposited inside the vagina, can survive up to 7 days, but we normally use the average of 5 days. So the fertility window is a kind of a tentative period when a woman has the best chance of becoming pregnant. So this window opens 5 days before your ovulation. So if we are using the same 28-day cycle, your fertility window will open on 5 days before day 14 and end a day after ovulation. So if you are 28-day cycle, your fertility window will open what? 5 days before day 14 and end on day 15. So that period of 7 days is the time you have the best chance of becoming pregnant. Now here's the deal. Nothing happens like mathematics. So your fertility window, your ovulation can change. It can fluctuate. Some people can have 28, 28, 29, 29, 30 days. The key word is to find the average. If they are fluctuating from 27, 28, 28, 29, 30, it's still going to give you about the same. If it's fluctuating from 21, 22, 24, it's still going to be the same. The problem starts when it's outside the range of normality, which is 21 to 35 days. So you need to be conversant with your ovulation. You need to be conversant with your fertility window. When you are conversant with your fertility window and your ovulation and you're regular, and every other factor that plays a role in reproduction is in check. So what do I mean by every other factor? So remember that reproduction takes two parties. So it takes your man having a very good sperm, quality sperm with good motility, good morphology, and good count to get you pregnant. So if your man has adequate sperm without problems and your ovulation and every other factor is taken care of, if you have a regular ovulation and a regular fertility window, then you're likely going to get pregnant within that time frame. So, in a simple summary, ovulation is part of your fertility window, and both factors are things that can help you to know yourself better and to plan ahead of time. So, it's important you understand that your own ovulation is unique and you can calculate it based on your cycle. So, if you have a 30-day cycle, it's not going to be the same with a lady that has a 28-day cycle. So 30-day cycle will give you an ovulation on day 16 if you apply factor 14. These are tentative calculations. It doesn't mean that it's hard and fast. The general rule of thumb for women that are looking for a baby is to do what? To increase the frequency of lovemaking and not to depend on having ovulation sex. So this is an area you need to be careful with. Some women will make the mistakes of waiting on day 14 only to meet with their partner without knowing that that day 14 has shifted to day 16 or day 18 or day 12. So the general approach in regards to achieving pregnancy is to do what? To scatter your lovemaking, to be very unpredictable, to increase the frequency. So the global recommendation is 3 to 4 times weekly. When you do this, you increase the ability, you increase the likelihood of becoming pregnant. So thank you for coming this afternoon, and hopefully I will be back. But until I come back, thank you and have a great day. Bye bye for now.